What should be done to manage the patient during SMR? The paramedic must at all times manage the patient to minimize spinal movement. What should be documented before and after SMR? The neurologic status of the patient. What are spinal boards or adjustable breakaway stretchers primarily used for? Extrication/patient lifting devices. When should the patient be removed from spinal boards or adjustable breakaway stretchers? As soon as it is safe to do so. Under what circumstances can spinal boards or adjustable breakaway stretchers remain in place? If the paramedic deems it safer/more comfortable for the patient in consideration of short transport times. What should be done for patients with suspected pelvic fractures? Secure them on a spinal board or adjustable breakaway stretcher as per the blunt/penetrating injury standard. In what positions can a patient with spinal motion restriction be placed? Semi-sitting or supine position, according to patient comfort/clinical condition. What should be done if a patient is unresponsive or uncooperative? Apply manual C-spine immobilization until appropriate SMR has been applied. When should cervical collars be placed on the patient? Prior to movement, if possible. What can patients involved in an MVC with isolated neck or back pain and no neurologic signs or symptoms do? They may be allowed to self-extricate using a stand, turn, and pivot onto the stretcher while maintaining neutral spinal alignment. What should be done for patients who already have a spinal board or adjustable breakaway stretcher applied by a first responder? They should still be assessed for SMR as per the standard, and SMR may be modified to meet the standard if necessary. Can SMR be modified for patients undergoing inter-facility transfers? Yes, SMR may be modified as per the standard in consultation with the sending physician, which may involve removal of a spinal board. What is the goal of using spinal boards or adjustable breakaway stretchers? To remove the patient from these devices as soon as it is safe to do so. How long can spinal boards or adjustable breakaway stretchers remain in place? If transport time is less than 30 minutes. What should be done for patients with suspected pelvic fractures? Secure them on a spinal board or adjustable breakaway stretcher as per the blunt/penetrating injury standard. What positions can a patient with SMR be placed in? Semi-sitting or supine position, based on patient comfort/clinical condition. What should be done if a patient is unresponsive or uncooperative? Apply manual C-spine immobilization until appropriate SMR has been applied. When should cervical collars be placed on the patient? Prior to movement, if possible. What can patients with isolated neck or back pain and no neurologic signs or symptoms do? They may be allowed to self-extricate using a stand, turn, and pivot onto the stretcher while maintaining neutral spinal alignment. What should be done for patients who already have a spinal board or adjustable breakaway stretcher applied by a first responder? They should still be assessed for SMR as per the standard, and SMR may be modified to meet the standard if necessary. Can SMR be modified for patients undergoing inter-facility transfers? Yes, SMR may be modified as per the standard in consultation with the sending physician, which may involve removal of a spinal board. What is SMR? Spinal motion restriction. What are SMR devices? C-collar, spinal board, adjustable breakaway stretcher. When may attempts to apply SMR lead to patient agitation? When the patient is markedly agitated, combative, or confused. What should paramedics do in situations where applying SMR increases patient agitation? Secure the patient to the stretcher with stretcher straps. What should paramedics do in conjunction with the documentation of patient care standard? Clearly document the circumstances of the safety hazard and their inability to apply SMR. What is the purpose of SMR? To minimize spinal movement. What is the role of a C-collar in SMR? To immobilize the cervical spine. What is the role of a spinal board in SMR? To provide a rigid surface for the patient's back. What is the role of an adjustable breakaway stretcher in SMR? To allow controlled movement while maintaining spinal immobilization. What is a do not resuscitate standard? A standard that outlines the actions paramedics should take in regards to resuscitation. What is cardiopulmonary resuscitation? Immediate life-saving measures for respiratory or cardiorespiratory arrest. What are some examples of CPR interventions? Chest compression, defibrillation, artificial ventilation, airway insertion, intubation, transcutaneous pacing, and advanced resuscitation drugs. What does do not resuscitate mean? Paramedics will not initiate any CPR interventions. What is considered as treatment? Any action or service provided for health-related purposes. What is a valid MO-DNR confirmation form? A completed form with patient's name and check condition. What information should be on a valid MO-DNR confirmation form? Patient's name and check condition. What is the purpose of a DNR confirmation form? To confirm the patient's decision to not be resuscitated. What is a pre-printed serial number? A unique number already printed on the form. What is the general directive for paramedics in regards to DNR? To follow the guidelines set out in the DNR standard. What is the purpose of CPR? To save the life of a person in respiratory or cardiorespiratory arrest. What is the ALSPCS? Advanced Life Support Patient Care Standards. What is the purpose of chest compression? To manually pump the heart during CPR. What is defibrillation? The use of an electric shock to restore normal heart rhythm. What is artificial ventilation? Providing breaths to a person who cannot breathe on their own. What is an oropharyngeal airway? A device inserted into the mouth to maintain an open airway. What is endotracheal intubation? Inserting a tube into the trachea to maintain an open airway. What is transcutaneous pacing? Using electrical impulses to regulate the heart rate. What are advanced resuscitation drugs? Medications used to support cardiac function during resuscitation. What is a valid DNR confirmation form? A current plan of treatment reflecting the patient's wish or consent of the substitute decision maker. When is CPR not included in the patient's plan of treatment? When the patient expresses their wish or the substitute decision maker consents. When is CPR not part of the plan of treatment according to the physician? When the physician believes it will not benefit the patient, and has discussed it with the patient or substitute decision maker. What does the checkbox on the form identify? The professional designation of the signing medical professional. What are the possible professional designations on the form? Medical doctor, registered practical nurse, registered nurse, or registered nurse in the extended class. What is required on the form? The printed name and signature of the signing medical professional. What is the significance of the date on the form? It must be the same as or precede the date of the request for ambulance service. What can be considered a valid DNR confirmation form? A fully completed original or a copy of a fully completed original. What is the general directive for paramedics? They shall not initiate CPR on a patient with a valid MO-DNR confirmation form, except in specific circumstances. When should a paramedic not initiate CPR? When the patient experiences respiratory or cardiorespiratory arrest, and has a valid MO-DNR confirmation form. When should a paramedic initiate CPR? When a patient has experienced respiratory or cardiorespiratory arrest, unless they have a valid MO-DNR confirmation form. What is the definition of CPR? Cardiopulmonary resuscitation, which includes chest compressions and rescue breaths. What is the purpose of a valid DNR confirmation form? To provide clear instructions regarding the inclusion or exclusion of CPR in a patient's plan of treatment. Who can express their wish regarding CPR in the plan of treatment? The patient when capable or the substitute decision maker when the patient is incapable. What is the role of the physician in the plan of treatment? To determine if CPR will benefit the patient, and discuss it with the patient or substitute decision maker. What is the role of the paramedic in relation to the valid MO-DNR confirmation form? To follow the general directive and not initiate CPR on a patient with the form, except in specific circumstances. What is the minimum duration of absent respirations and pulse for a paramedic to not initiate CPR? At least 3 minutes from the time respiratory or cardiac arrest was noted by the paramedic. What is the authority responsible for the basic life support patient care standards? Emergency Health Regulatory and Accountability Branch, Ontario Ministry of Health. What version of the basic life support patient care standards is referenced? Version 3.4. What is a mode DNR confirmation form? A form indicating a patient's wish to not be resuscitated. What are the two scenarios in which a patient with a valid mode DNR confirmation form may express a wish to be resuscitated? A. If the patient is capable and clearly expresses a wish to be resuscitated in the event of respiratory or cardiac arrest. B. If the patient is capable but the request is vague, incomplete, or ambiguous. What patient management should the paramedic provide? Comfort and pain alleviation as required by the patient's clinical condition. What should the paramedic do once it has been determined that death has occurred? A. Advise the CACC/ACSB follow the deceased patient standard. What should the paramedic note and document in conjunction with the documentation of patient care standard? The time at which the paramedic confirms the patient was deceased. What is the deceased patient standard? A set of guidelines for identifying deceased patients. What is a deceased patient? A patient who is obviously dead. How can a patient be considered deceased? If they are obviously dead, have a medical certificate of death, have no vital signs, and a DNR confirmation form, have a TOR order, or have a withhold resuscitation order. What is an expected death? A death that was anticipated due to a terminal illness. What does obviously dead mean? Death is evident through gross signs such as decapitation, visible decomposition, absence of vital signs, or other specific conditions. What is a palliative care team? A group of healthcare professionals who provide care to terminally ill patients. Who is a responsible person? An adult who can stay with the deceased patient and take responsibility for them. What is a termination of resuscitation order? An order given by a base hospital physician to cease resuscitation efforts on a patient with no vital signs. What is a medical certificate of death? A document prescribed by the Vital Statistics Act that certifies a patient's death. What is a mode do not resuscitate confirmation form? A form that confirms a patient's do not resuscitate status, issued by the Ministry of Health. What is a withhold resuscitation order? An order given by a base hospital physician to withhold resuscitation efforts on a patient with no vital signs. What is the Vital Statistics Act? An act that governs the registration of vital events, including deaths, in Ontario. What are the criteria for obviously dead? Gross signs of death or absence of vital signs with specific conditions. What are the signs of obviously dead? Decapitation, visible decomposition, absence of vital signs, grossly charred body, open head or torso wound with outpouring of contents, gross rigor mortis, or dependent lividity. What is dependent lividity? Fixed, non-blanching purple or black discoloration of the skin in the dependent area of the body. What is gross rigor mortis? Stiffness or posturing of limbs or body after death. What is a grossly charred body? A body that has been severely burned. What is a medical certificate of death? A document that certifies a patient's death, prescribed by the Vital Statistics Act. What is a DNR confirmation form? A form that confirms a patient's do not resuscitate status, issued by the Ministry of Health. What is a base hospital physician? A physician who provides medical oversight and guidance to paramedics. What is a withhold resuscitation order? An order given by a base hospital physician to a paramedic to not initiate resuscitation measures. What is an unexpected death? A death that was not imminently anticipated. What is a procedure for paramedics in cases of death? Confirm patient is deceased, treat with respect, consider family needs. What should paramedics do in cases of suspected foul play? Follow directions in the police notification standard. What should paramedics do if there are directions from a coroner? Follow all directions issued by a coroner or their appointee. What should paramedics do if termination of resuscitation occurs in the ambulance? Advise CCC/ACS to contact the coroner and continue to the destination. What should paramedics do in cases of obvious death? Note and document the time of confirmation of death. What should paramedics do in cases of unexpected death without police or coroner on scene? Advise CCC/ACS of the death, who will notify the police or coroner. What should a paramedic do if a coroner will attend at the scene? Remain at the scene until the coroner arrives and assumes custody of the deceased patient. What should a paramedic do if a coroner will not attend at the scene? Remain on the scene until the arrival of a person appointed by a coroner or to whom a coroner has delegated powers or authority. When can a paramedic depart the scene if police are present and have secured it? As soon as documentation has been completed or when assigned to another call. What should a paramedic do if they have not received any further direction from CCC/ACS? Request that CCC/ACS seek direction from the coroner concerning their responsibilities, including whether they may leave the scene. Does an unexpected death always require investigation by a coroner? No, an unexpected death does not necessarily require investigation by a coroner. What should a paramedic do in cases of expected death? Advise CCC/ACS of the death. Who should a paramedic request to notify the primary care practitioner or a member of the palliative care team? A responsible person, if one is present. What should a paramedic request of a responsible person in cases of expected death? To notify the primary care practitioner or a member of the palliative care team and request their attendance at the scene. What is the purpose of the Basic Life Support Patient Care Standards? To provide guidelines for paramedics in providing patient care. Who is responsible for the Basic Life Support Patient Care Standards? Emergency Health Regulatory and Accountability Branch, Ontario Ministry of Health. What should a paramedic do if they have not received any further direction from CCC/ACS? Request that CCC/ACS seek direction from the coroner concerning their responsibilities, including whether they may leave the scene. What should a paramedic do if a coroner will attend at the scene? Remain at the scene until the coroner arrives and assumes custody of the deceased patient. What should a paramedic do if a coroner will not attend at the scene? Remain on the scene until the arrival of a person appointed by a coroner or to whom a coroner has delegated powers or authority. When can a paramedic depart the scene if police are present and have secured it? As soon as documentation has been completed or when assigned to another call. What should a paramedic do if they have not received any further direction from CCC/ACS? Request that CCC/ACS seek direction from the coroner concerning their responsibilities, including whether they may leave the scene. Does an unexpected death always require investigation by a coroner? No, an unexpected death does not necessarily require investigation by a coroner. What should a paramedic do in cases of expected death? Advise CCC/ACS of the death. Who should a paramedic request to notify the primary care practitioner or a member of the palliative care team? A responsible person, if one is present. What should a paramedic request of a responsible person in cases of expected death? To notify the primary care practitioner or a member of the palliative care team and request their attendance at the scene. What is the purpose of the Basic Life Support Patient Care Standards? To provide guidelines for paramedics in providing patient care. Who is responsible for the Basic Life Support Patient Care Standards? Emergency Health Regulatory and Accountability Branch, Ontario Ministry of Health. What happens if the responsible person is unable to provide notice? Paramedic advises CCC/ACS of the death. What does CCC/ACS do if the responsible person is unable to provide notice? Attempts to notify primary care practitioner or palliative care team. What does the paramedic do if the primary care practitioner or palliative care team member will attend at the scene? Remains at the scene until their arrival. Under what circumstances can the paramedic depart the scene? If there is a responsible person present and they will remain until the arrival of the primary care practitioner or palliative care team, or if the police are willing to remain. What does the paramedic do if the primary care practitioner or palliative care team member cannot be contacted or attend? Advises CCC/ACS, who will notify the police or coroner. What does the paramedic do if requested by the coroner? Provides the coroner with the circumstances of the death. What happens if the paramedic is released from the scene by the coroner? They can leave the scene. What happens if the paramedic is instructed to remain with the deceased patient by the coroner? They stay with the patient until the coroner or a person appointed by the coroner arrives. Who does the paramedic notify if the responsible person is unable to provide notice? CCC/ACS. Who does CCC/ACS attempt to notify if the responsible person is unable to provide notice? Primary care practitioner or palliative care team. Who does the paramedic remain at the scene for if they indicate they will attend? Primary care practitioner or palliative care team. Under what conditions can the paramedic depart the scene? If there is a responsible person present and they will remain until the arrival of the primary care practitioner or palliative care team, or if the police are willing to remain. Who does the paramedic advise if the primary care practitioner or palliative care team member cannot be contacted or attend? CCC/ACS. Who does CCC/ACS notify if the primary care practitioner or palliative care team member cannot be contacted or attend? Police or coroner. Who does the paramedic provide the circumstances of the death to if requested by the coroner? Coroner. Under what conditions can the paramedic be released from the scene by the coroner? If the coroner or a person appointed by the coroner arrives. What does the paramedic do if the responsible person is unable to provide notice? Advises CCC/ACS of the death. What does CCC/ACS do if the responsible person is unable to provide notice? Attempts to notify primary care practitioner or palliative care team. What does the paramedic do if the primary care practitioner or palliative care team member will attend at the scene? Remains at the scene until their arrival. Under what circumstances can the paramedic depart the scene? If there is a responsible person present and they will remain until the arrival of the primary care practitioner or palliative care team, or if the police are willing to remain. What does the paramedic do if the primary care practitioner or palliative care team member cannot be contacted or attend? Advises CCC/ACS, who will notify the police or coroner. What does the paramedic do if requested by the coroner? Provides the coroner with the circumstances of the death. What happens if the paramedic is released from the scene by the coroner? They can leave the scene. What happens if the paramedic is instructed to remain with the deceased patient by the coroner? They stay with the patient until the coroner or a person appointed by the coroner arrives. What should the paramedic be aware of during the primary survey in pediatric patients? Problems arising due to pediatric anatomy and physiology. What is the primary cause of pediatric cardiac arrest? Respiratory arrest. What vital signs should the paramedic recognize as normal in pediatric patients? As per the ALSPCS. How should the paramedic determine CTS levels in pediatric patients? As per the pre-hospital CTS paramedic guide. What assessments should be considered in pediatric patients? Change in appetite, change in behavior/personality, excessive drooling, decrease in number of wet diapers, inconsolable crying or screaming, lethargy, patient positioning, and work-up breathing. What should the paramedic maintain when assessing pediatric patients? A high index of suspicion. How should a full secondary survey be conducted in pediatric patients? From toe to head. Should caregivers be present during patient care? Yes, unless they are interfering with the care. What should be assessed in infant patients? Fontanelles. What should be ensured when handling an infant patient? Proper support to the head and neck. Child in need of protection. A child who is or appears to be suffering from abuse and/or neglect. Duty to report. The requirement to promptly report any reasonable suspicion that a child is or may be in need of protection. Reasonable grounds. The information that an average person would need to decide to report. General directive. Actions that a paramedic must take when they have reasonable grounds to believe a child is in need of protection. Ensure the patient is not left alone. Make sure the child is not left unattended. Request police assistance at the scene. Call the police if the child is at risk of imminent harm. Guideline. Types of pediatric problems that require specific attention when determining if a child is in need of protection. Submersion injury. An injury caused by being submerged in water. All burns. All types of burns, including thermal, chemical, and electrical. Accidental ingestion/poisoning. When a child accidentally ingests a harmful substance. Other types of in-home injuries, for example falls. Injuries that occur inside the home, such as falls. Scene observations. Things that a paramedic may notice at the scene that indicate a child may be in need of protection. Household/siblings dirty, unkempt, and/or in disarray. The home and siblings are dirty, messy, or disorganized. Evidence of violence, for example overturned or broken furniture. Signs of violence, such as furniture being overturned or broken. Animal/pet abuse. Signs of abuse or neglect towards animals or pets. Evidence of substance abuse, for example empty liquor bottles, drug paraphernalia. Indications of substance abuse, like empty liquor bottles or drug-related items. What are some physical signs that may indicate a child is in need of protection? Growth or multiple deformities, multiple new and/or old bruises, distinctive marks or burns, bruises/burns in unusual areas, signs of long-standing physical neglect, signs of malnutrition, signs of shaking syndrome. What are some examples of distinctive marks or burns that may indicate a child is in need of protection? Belt marks, hand imprints, cigarette burns. Where are some unusual areas for bruises in children? Chest, abdomen, genitals, buttocks. Where are some unusual areas for burns in children? Buttocks, genitals, soles of feet. What are some signs of long-standing physical neglect in children? Dirty, malodorous skin, hair, and clothing, severe diaper rash, uncut/dirty fingernails. What are some signs of malnutrition in children? Slack skin folds, extreme pallor, dull/thin hair, dehydration. What are some signs of shaking syndrome in children? Hemorrhages over the whites of the eyes, hand or fingerprints on the neck, upper arms or shoulders, signs of head injury unrelated to the incident history. What should be considered when obtaining a history of the incident? Validity of the history provided. What are some indicators that the history provided may not be valid? What is meant by interaction between parents/caretakers? How parents/caretakers interact with each other. What are some examples of negative interaction between parents? Open hostility or avoidance of each other. What is meant by appropriateness of parental/caretaker response? How parents/caretakers respond to the child's injury or distress. What are some examples of inappropriate parental response? Lack of concern or anger directed towards the child. What is meant by appropriateness of child's behavior? How the child behaves in relation to the situation or injury. What are some examples of inappropriate child behavior? Inappropriate fear, indifference, or lack of emotion. What should you avoid doing when suspecting child abuse? Making accusations or comments in front of parents or bystanders. What should you do in all cases when encountering suspected child abuse? Transport the child. Who should you report suspicions of child abuse to? The receiving hospital, and complete the duty to report to the CS. What takes precedence over other provincial statutes when it comes to reporting child abuse? The duty to report under the Child and Family Services Act. What is the consequence of failing to report suspicions of child abuse? It is an offense under the Child and Family Services Act. Who does the duty to report extend to? Any child encountered in the paramedic's professional duties, not just those requesting 911 services. What should the paramedic assume about geriatric patients? Normal hearing, sight, speech, mobility, and mental function. What are some guidelines for treating geriatric patients? Typical signs and symptoms, comorbidities, diminished responses to pain, infection, heat/cold, susceptibility to skin tearing, abrasions, and bruising, increased risk of adverse effects from medication use. What should the paramedic assess regarding the geriatric patient? Living accommodations, living situation, ability to perform activities of daily living. What are some activities of daily living? Bathing, dressing, transferring, toileting, eating. What resources can the paramedic consider for the geriatric patient? Referral to local agency resources, such as Community Care Access Center, 211. Who can provide collateral information about the geriatric patient? Relative, friend, or neighbor. What should the paramedic be aware of regarding elder abuse? Patient presentations associated with elder abuse. What are some forms of elder abuse? Financial abuse, psychological abuse, physical abuse, sexual abuse, neglect. What should the paramedic do if elder abuse is suspected? Offer to contact police if they are not on scene, and alert receiving facility staff. What should a paramedic consider in situations involving a patient with an emotional disturbance? Underlying organic disorders. What should a paramedic give particular attention to in these situations? Personal safety as per the General Measures Standard. What should a paramedic assume in cases of patients with known or suspected suicide attempts or self-harm? All attempts are of serious intent. What should a paramedic ask the patient directly in these cases? Whether they have ideation or intent of suicide or self-harm. In cases where a patient is being transported without consent, what should a paramedic do? Not proceed with transport unless in possession of the appropriate documentation and/or escort. What implications does the Mental Health Act have on the manner in which a paramedic may deliver care? A person recommended for admission to a psychiatric facility as an informal or voluntary patient may not be transported without consent. Who may be transported without consent, subject to the provisions of the Mental Health Act. the subject of an application for assessment, the subject of an order for examination, a person taken into custody by a police officer, and a patient detained in a psychiatric facility under a certificate of involuntary admission or a certificate of renewal. What is the form used for an application for assessment? Form 1. What is the form used for an order for examination? Form 2. What is the form used for a certificate of involuntary admission? Form 3. What is the form used for a certificate of renewal? Form 4. What is the purpose of the Mental Health Act? To provide provisions for the care and treatment of individuals with mental health disorders. What is the General Measures Standard? A standard that paramedics should follow to ensure personal safety. What is ideation? Thoughts or ideas. What is the purpose of asking a patient directly about suicide or self-harm? To assess their intent and provide appropriate care. What is the purpose of the documentation and/or escort when transporting a patient without consent? To ensure proper authorization and safety during transport. What is an informal or voluntary patient? A person recommended for admission to a psychiatric facility by a physician. What is an application for assessment? A document signed by a physician to initiate an assessment of a person's mental health. What is an order for examination? A document signed by a justice of the peace to authorize an examination of a person's mental health. What is a certificate of involuntary admission? A document that allows a patient to be detained in a psychiatric facility against their will. What is the Emergency Health Regulatory and Accountability Branch? Branch of Ontario Ministry of Health. When should an escort be provided for a patient? If the patient is violent or potentially violent, or in custody under court or Ontario Review Board disposition. Who designates the escort for a patient in custody? A justice of the peace or hospital's officer in charge or delegate. When should a patient be restrained? If directed by a physician or police officer, if an unescorted patient becomes violent en route, or if restraints are required for emergency treatment. What is the requirement for the use of force when restraining a patient? Only reasonable and minimum force should be used. What should happen if restraints are applied prior to departing a scene? A physician, escort or police officer ordering the restraint should accompany the patient in the ambulance. What should happen if a police officer has handcuffed a patient? The paramedic should not proceed with transport until the police officer takes the patient into custody and is present in the patient compartment. What should be done for inter-facility transports involving restraints? Advise that all restraints must be provided and applied by hospital staff or police prior to transport. When can a paramedic proceed with an inter-facility transport involving a restrained patient? If the sending physician or sending facility has determined that the patient can be transferred safely, and the patient does not appear to be a safety risk or have the potential to become violent en route. What should be documented if a patient is restrained? Why should restrained patients be monitored closely? Restrained patients are more susceptible to rapid deterioration. What is the guideline for transporting a patient in the prone position? Do not transport a patient in the prone position. What should be done before initiating full body restraint? Attempt to organize the team before attempting restraint. What should be done to prepare for full body restraint? Prepare all equipment in advance. What should be done to inform the patient about the need for restraint? Inform the patient of the need to restrain them and explain the procedure. How should the patient's limbs and head be immobilized during full body restraint? Grasp each limb at the main joint and between the main joint and the distal joint, for example one hand on the elbow, the other on the forearm. What positions can the patient be placed in during full body restraint? Supine spread eagle position or left lateral position. How should the extremities be restrained during full body restraint? Restrain extremities as follows. What are the different ways to secure a patient to a stretcher? Secure one arm above the head, and the other to the stretcher at waist level, or secure both hands to one side of the stretcher. Why should the head of the stretcher be elevated? To protect the airway, and to allow the paramedic greater visibility. What should be done to secure the feet of the patient? Secure the feet. Where should the limbs be secured on the stretcher? To the main frame of the stretcher, not to the stretcher's side rails. What should be considered if the patient is spitting? Consider use of a surgical mask on the patient. What should a paramedic consider in situations involving a violent or aggressive patient? Underlying organic disorders. What should a paramedic give particular attention to in situations involving a violent or aggressive patient? Personal safety as per the General Measures Standard. When should a paramedic request police assistance on scene in situations involving a violent or aggressive patient? In all situations. When should a paramedic wait for police assistance in situations involving a violent or aggressive patient? If there is an active shooter scenario or direct evidence of ongoing violence. What should a paramedic do if electing to delay service in situations involving a violent or aggressive patient? Immediately notify CCC/ACS. What should a paramedic do if the patient is uncooperative in situations involving a violent or aggressive patient? elicit information from others at the scene and attempt to determine if illness, injury, and/or alcohol/drug ingestion has triggered the present behavior, and whether there is a past history of violence. What should a paramedic be alert for in situations involving a violent or aggressive patient? Behavioral signs of impending violence. What should a paramedic do if confronted by a violent or aggressive patient? Seek a safe egress and attempt to withdraw. What should a paramedic do if a safe withdrawal is not feasible in situations involving a violent or aggressive patient? Attempt to speak with and calm the patient. What should a paramedic consider in situations involving a violent or aggressive patient? The need for restraints as per paragraph 6 of the Mental Health Standard. What should a paramedic do in situations involving a patient with an embedded electronic control device probe? Remove ECD probe. When should a paramedic consider leaving the ECD probe in place and patient transport? When the ECD probe is embedded above the clavicle, in the nipple, in the genital area, or other unusual circumstances. What should a paramedic note about the preservation of ECD probe in situations involving a patient with an embedded ECD probe? Police may require preservation of the probe for evidentiary purposes. What is the flow rate to maintain IV patency for a patient less than 12 years of age? 15 milliliters per hour of any isotonic crystalloid solution. What is the flow rate to maintain IV patency for a patient greater than or equal to 12 years of age? 30 to 60 milliliters per hour of any isotonic crystalloid solution. What is the maximum flow rate for fluid replacement in an IV line? Up to 2 milliliters per hour to a maximum of 200 milliliters per hour. What are some substances that can be administered through an IV line? Thiamine, multivitamin preparations, drugs within the paramedic's level of certification, and potassium chloride for patients greater than or equal to 18 years of age. What is the maximum amount of potassium chloride that can be administered in a 250 milliliters bag? 10 mg. When should a paramedic request a medically responsible escort for an IV procedure? What should a paramedic do before transporting a patient with an IV line? Confirm the physician's written IV order with sending facility staff. What information should a paramedic determine before transporting a patient with an IV line? IV solution, IV flow rate, catheter gauge, catheter length, and cannulation site. What should a paramedic note before transporting a patient with an IV line? The condition of the IV site prior to transport. What should a paramedic confirm before transporting